A very popular session on day one of the Congress was on mobile devices. The question was asked, is it appropriate to use your smartphone to read a study? Emanuele Neri, is it appropriate to use a smartphone to read a study for a radiologist?
It is appropriate, but in a specific situation. This is the message I tried to give to the audience this morning at the end of my lecture. That we identified through the literature analysis. There is not so much published about this topic. And so we can conclude from what has been tested by some research team that the use of, and I prefer to say tablets instead of smartphones, could be recommended maybe in emergency situation where you need an expert opinion on, for example, CT of the brain, gastrointestinal bleeding, or trauma in general, where the radiologist can provide an immediate opinion about an urgent case.
Okay.
This can be one of the situations.
Now, what about if you take your mobile device outside of the hospital? If you want to read a study, to consult with a surgeon, to discuss the case, would you recommend that at all?
I would not recommend to use such mobile device outside the hospital because, as we discussed this morning, there are safety issues, ethical issues about bringing patient data outside the hospital. You must actually, there are no guidelines about that. And so it's not safe to bring patient data outside the hospital.
Okay. How about in Pisa, in your own hospital? Are there any special practices, any standards that you set in Pisa?
At the moment, we do not use tablet for reading DICOM images, but we use that tablet for multidisciplinary group discussion. Maybe it's probably I am the only one radiologist that used actually such a device, and I bring this device during, for example, tumor boards, where I can bring the images and discuss more efficiently the case with the surgeons or with the oncologist or radiotherapist.
And would you provide for your trainees, for your residents, would you provide mobile devices for them to use?
We thought about that. Actually, we are not yet provided them with tablets, but they have their own device. And they use this device, as far as I know, and of course we cannot control what they do on their devices, but as far as I know, they use such devices mainly for teaching purposes.
Now, do you think looking ahead in another 2, 3, 5 years, every radiologist will be reading studies on mobile devices?
Maybe on tablet in a specific situation, and I think that most of them will be radiologists of the new generation, those that are more trained to use tablets and all the facility, or social media and so on. Okay. Even if our generation is already a little bit well trained.
Good. Now, you're very involved as president of the European Informatics Society, EuSoMII, and could you update us a little on what developments there are in the pipeline for EuSoMII this year?
Yes, the main activity for 2016 is the development of a series of webinars. The Society started to carry on webinars in image informatics since January. All these webinars are held on Monday at 5 o'clock, are freely available, so everyone can register and join the webinar.
Do you have to be a member of EuSoMII to join the webinar?
Not at the moment. We decided to leave the webinar free for everyone, but there will be a moment in which this webinar will be available only for EuSoMII members. So my recommendation is to become a EuSoMII member, of course.
And you also have your Congress in October in Valencia. Could you tell us a little bit about that?
Yes, this meeting will be held from 6 to 8 October. under the local organization of Angel Alderic Bayarri, which is member of the EuSoMII board, and Luis Martí Bonmatí, and will be a joint meeting with the European Society of Oncologic Imaging Society.
Okay, Emanuele, I wish you a very successful week and good luck with your preparations for Valencia.